Hi, my name is Eva Quesada, and today I will be discussing ovarian cancer. Ovarian cancer is a cancer that is produced in the ovaries of a woman's reproductive system. There are three types of cells that make up the ovary that can develop into cancer: the epithelial tumors that begin from the outer surface of the ovary, germ cells that can develop into tumors from the cells producing eggs, and stromal tumors that are structural tissue holding the ovary together. The epithelial ovarian tumors are also called benign because they do not spread and usually do not develop into serious illnesses like cancer. Other epithelial cells, such as the malignant cells, are cancerous and is where 85 to 90% of malignant ovarian cancers are epithelial ovarian carcinomas. The three types of cancer are surface epithelial, germ cells, and stromal cells. There are 4 stages in ovarian cancer. The first stage is when the cancer is found on either one or both ovaries or fallopian tubes, or if one of these have oozed out outside of the ovaries. Stage 2 is when the growth of the cancer has evolved to one or both of the ovaries and have extended over to other pelvic organs or the uterus. Stage 3 is when one or both of the ovaries with cancer has spread beyond the pelvic, either into the abdominal muscles or lymph nodes. In stage 4, the cancer in the ovaries has either evolved to fluid around the lungs, cancer inside the lungs, liver, or spleen, or other parts of the body. When treating ovarian cancer, there are a few treatment options available for women depending on the stage that the cancer has developed. Such treatment options include surgery for the removal of the cancerous tumor and tissue performed by a gynecologic oncologist, chemotherapy to reduce the size of tumors prior to surgery, or radiation therapy. Other therapies, such as targeted therapy, is used to target the cancerous cells without harming the healthy cells within the client's body. According to Centers for Disease Control and Prevention, in 2015, 11.3% of white women had ovarian cancer, 8.5% of black women had ovarian cancer, 7.9% of either American Indian or Alaska Native, 9.0% were either Asian or Pacific Islander, and 9.8% were Hispanic. These percentages can indicate that some women of different ethnic groups have a higher prevalence of developing ovarian cancer than other groups. Although all women are at risk for developing ovarian cancers, other risks include genetic predisposition of cancer, either familial or personal history of either breast, ovarian, or colon cancer. Higher risk of ovarian cancer increases for women who are older and who are fertile. Despite these risk factors, there are some methods of preventing developing ovarian cancer, such as seeking genetic counseling, maintaining a healthy diet, and exercising. Other ways could include a transvaginal ultrasonography every 6 months for women who are at high risk. If a woman is on birth control, she may be able to reduce her risk for up to 50% of developing ovarian cancer. If a woman is already seeking surgical procedures such as a tubal ligation or a hysterectomy, she should discuss with her doctor the pros and cons of removing her ovaries to reduce the risk of developing ovarian cancer. Some signs or symptoms of ovarian cancer include but are not limited to bloating, pelvic or abdominal pain, needing to urinate urgently or quickly, trouble eating or feeling full quickly, fatigue, upset stomach or heartburn, pain during sex, back pain, constipation, or menstrual changes. If any of these symptoms persist for more than 2 weeks and do not resume to normal functioning, then it is recommended for a woman to see a gynecologic oncologist and her doctor prior to surgery if she does have any suspicions of having ovarian cancer.